Guys, welcome to our YouTube channel. Finally, my brother is back from Canada, Daniel. Everybody knows he's famous.
How are you guys?
And I'm good, bro. And you?
Good to see you guys. Good to see you. Good to
Appreciate
be
it.
back.
Likewise, bro.
Thank you,
Likewise.
brother. I'm good. Good. I just
So-
came for nail removal and yeah, everything been fine. Like, just the first day was a bit, I had a bit of soreness around my
Okay.
hips, but then I'm good. I can walk. I'm using crutches just for safety, just for my own safety, but I can walk without crutches as well.
So when was your surgery?
My surgery was the first surgery was almost 4 years ago.
4 years.
Yeah,
Wow.
30th of April 2021.
Okay.
And the removal was around September.
Okay.
And so yeah, more than 3.5 years after removal. I came eventually 2 years ago to check everything. And then something happened and I said, okay, let me go back. And then whenever it was the time, I didn't have anything problem with the nail, but I just wanted to take it out, right?
Okay.
It wasn't bothering me to say oh, every day I'm this is bothering me. No, sometimes I could, for example, if I wanted to run or something, I could feel some pins out around the screws. I could feel something, so I just wanted to take it out. The feeling of not having it was definitely.
But there was not restrictions, right?
No, not I can't say really restrictions, which was no.
A lot of people will ask now in the comments, I'm sure, why you came after 3-4 years and not after 1 year for the nail removal.
Yeah. To be honest, I just had to find the right timing. That's the main reason. It's not just. I know a lot of people. I can't throw in names, but I know a lot of people who did at the same time I did, at the Wolf Hotel. So they removed maybe 10 months after removal, 1 year, 1.5 year. I just didn't find the right timing, and it didn't bother. When I asked doctor, he said you can even live with it, but it's better to come out. It was better to come out, but yeah, I just wanted to come out.
Can you feel a really difference with nail and without nail, bro?
With nail and without nail, I would right now I just started to walk, but even I'm saying before, the nail wasn't really bothering me, to be honest. It was inside the leg, but I think once I get more mobile, I think my flexibility will get a bit better, and I think those pains that I had around the screws will be gone. Yeah, but yeah, not a big issue. To be honest, no, I don't have. It's good now. It's good now. Yeah.
Bro, it's 4 years since you did the surgery, so I know. So I mean, I remember,
Yeah.
you asked me a lot of time, bro, what do you think? I'm doing boxing, and can I do this again?
Yeah.
I mean, of course,
Yeah.
as other patients, you had also some questions in your mind and,
Yeah.
worried and something like that. But, bro, what can you say? Because right now you are a different type of patient because you did it, and it's 4 years.
4
Since
years,
4
yeah.
years exactly. How old are you right now?
29.
29, bro.
Yeah,
Once
you
it was
You
25.
were, you were 29, I guess. Back
Yeah,
then.
exactly. Yeah, and I mean it's also a huge difference,
Yeah.
So, what you can say as a former patient who did the surgery and after 4 years, because a lot of people are thinking when I do the surgery, what will happen after 2 years, 3 years, 4 years, or maybe
Yeah.
I will get worse, or can you say something about
Yeah,
that?
yeah, for sure. I was not the easiest candidate, right? I always said that, the bigger you are, the harder this thing would be, especially with LON. And I had some difficult compared to other patients. My mobility at the beginning phases was a bit harder, and same even after removal. I was more cautious to unfortunately, God forbid, nothing happened to the nail or anything. So I was keeping the crutches for a good 3 months. So I was always in contact with doctor and you to see if I'm doing good, and I will always send you X-rays. So I would say that after the first 3 months, I was posting a lot of videos to say update 3 months, 4 months, 5 months. I would say 3 months. After 3 months, it was it was like this, and then 3 months went up. I can say 6 to 7 months after removal, I was back to almost 100% of doing daily stuff. I wouldn't say sprinting, but I would say like daily chores, normal stuff.
Okay.
Average person doesn't like really like go work out. Not a lot of people do that. Like just a fraction of them. So I was doing like daily stuff, but I would say like more explosive. It came to me maybe 1.5 years after removal. It came back to me, and then in terms of running and jumping high, I would say those are like the things that you have to more practice on it. And I also had like some knee problem from before, which was that's why honestly, to be honest, that's why, because I was always really athletic. I was participating in a lot of sports, but at some point I had some early arthritis in my patella. Eventually I was kind of forced to put those side of my explosiveness away because of that. And that's when I said, okay, I know I researched about it. Uh, as long as I get my desired length, I'll be happy, and I can just walk and do my daily stuff. And so I would say like after a good 2 years, I guess you can do those athletic stuff as well. But some people like after 1 year, compared to how much you did and
Of
everything.
course.
And I'm still in contact with a lot of the guys who did at that time. A lot of them came back really good, way better than me, way. But because they didn't show their face, like you may not be able to see them. But like I'm in contact with a lot of them. The time I came back 2 years ago, I met them in London. Two of them.
I
I met
remember.
them. I met them in London. I was there in London
Yeah.
in 2 days, so I met
Okay.
them. And he probably removed. He did also 8.5. He removed maybe 3 months before me, and he gained and he was 30 something years old. I don't want to throw his name, but you saw his videos. There's a video of him. But he was great, man. He was great. I was really impressed by he was running, jumping, doing everything 1.5 years after removal. And like there was another guy like from USA. He has a video, well, I'm not gonna throw his name again. He did it around 5-6 centimeters, but I know he's hats off to him. He has finished like a marathon, and I was like impressed. I was like, great job, man. Like he removed probably like 10 months or about a year after removal. Like he removed his nails as well. He said, I want to participate in a marathon, and I was like happy for him, to be honest. He was a bit, he said, why did I finish at 5? But then he was like, say, okay, I'm good that I'm back to everything now. And I was happy for them, man.
Wow,
It's
great, bro.
great.
I mean, look, so first of all, I also will talk a little bit about the facts with you because, there's a lot of questions, bro. I mean, why people is doing that? I mean, are you crazy and spend your money for something, other thing, like for something else? But guys, the problem here is, this, for example, you reached
8 to 9.
8 to 9 approximately,
Something,
right?
yeah.
Exactly. So this is not only a 8-9 centimeter, which I always mention about it, but bro, this is, for example, like simple things. Just once you stand up in the morning, like you look at yourself in the mirror, or you are going to beach and you wear some shorts, right? I mean, you are, I don't know, like you are walking like in a street which with a lot of people, and you are in a different height. Also, just you are driving car. I mean, you don't need to sit, like
Really
front,
front,
like
right?
behind. I mean, this is not only the 8-9 centimeter on height, which you gain in centimeters. I mean, they change really a lot of things. Of course, it's a procedure. It's a process. I mean, it's not an easy process. It was also not for me, but it's really, really good to hear that you are
Yeah.
doing good, bro,
No, no,
and you feel good.
Yeah, honestly, I would say it's really mental. Like, we had a lot of things in common. Even like the pain of like even being small, like since childhood. Like not small, but shorter. Like you had that, and I was experiencing that as well. And just living with that pain in your head every day was the biggest pain I've ever experienced in my life. And I knew I had to do something for it. Otherwise, I could not live like that. I always said I was open about my, you know, the things that I was experiencing, because a lot of people were not really saying that. I said that to say, guys, that's the only way. I never advise anyone to do it or not to do it. The sum of our decisions. You are here because of the decisions that you made in your life. I'm here because of my decisions that I made in my life. I cannot prescribe my thing to you and you cannot do the same thing. So I would never advise to anyone to do or not to do. You have to first know your priorities in your life. If your priority is your family or anything else, you need to know your priorities. If your priority is this, your mental health, is if this is affecting, I always said that's the only way that you can properly change it. There is pain involved, there is a discomfort involved, there is potential complications involved. Happened to me, happened to you, happened to people. But at the end, if those things can be taken care of properly, at the end, if you can get rid of that mental barrier that was built up in your head, then that's all matters. If that's your priority. If your priority is your family or anything else, if it's your financial goals, maybe if it's my athletic career, maybe I'm not gonna risk it now. I've seen a lot of people with in different stages of their life. They did a lot, they did pretty great in different areas of their lives. Then they felt okay, I still have this void in my life. Then they do it a later stage of their lives, and they always say, "Oh, I wish I had done this earlier." That's the thing. If you think you cannot really get rid of these thoughts, I always say that's the only way you can do it. That's the only way. My personal experience, I always said I really, really not even 1% regretting nothing, even though I had it maybe harder than a lot of people. The first times I was getting click, I was, bro, why am I getting these clicks? It was really
Yes, I
painful
know,
at the
bro.
beginning. That to get those clicks, it was harder. I was asking people, they said, no, I never experienced that. It was harder for me to be mobile, standing up, sitting down, sleeping on the back. Yeah, these things were hard for me at the beginning. But I really wanted with every drop of my blood. I really
Yeah, bro,
wanted
I
that.
know, bro.
I said, I knew I cannot even the nerve pain. That's a good thing that you said. The nerve pain started. I remember we talked about it. I said, bro, this thing is killing me. I can't really lengthen it anymore. You said, okay, stop, take liver. If we can't, we don't want to damage you. We have to take the fixators off. I was at 5. I talked to doctor, if you can't do it, we need to take off. We don't want to you have risk of infection. You don't want to just have it on you. I could have made a decision to say, okay, you gave me your advice, your ethical advice. You and doctor, you guys gave me your ethical advice. Said okay, we need to get rid of this. Okay? If anything after that was happening to me, it was on me. I chose to say, okay, I'm gonna take it.
Exactly, bro.
I wanted to stay with it. I shortened my leg to get rid of the pain a bit, and then go a bit, and the bone got closed, another osteotomy cut. These are all the things that because I really wanted that. My first priority was that. Even if my nerve pain was being a bit permanent, even if it was becoming permanent, I still chose to opt for that direction. I can't blame you on that. You gave me your advice. Okay, maybe stop at 5. That's okay. Maybe later on we can do tibia or something like that. And but when I was emotionally was saying I can't, I just can't do it. It's easy for you to say it's. I know what you're saying. You want to protect me or you want to, but I really can't. I have to make it happen. It's and after that when I'm out of that thing, I always said that it was like a switch which was off on my head. I'm so glad that I did it. Thank God, my nerve thing was not permanent. It was just a temporary thing. But even if it was a bit, if I was feeling a bit of numbness, even if I was feeling to this day, I cannot blame that on you. I cannot blame that on anybody. That's my decision. That's what I chose to do. And I have to stand by it. You need to know your priorities in your life. That's what I'm saying. If your priority is your height, if your priority is to do it, even maybe you need to take more calculated risks. Maybe maybe I should have not, because at some points we were getting in the habits of lengthening a bit more just to get rid of the fixators. Maybe if I go back, I do a bit more calculated. Maybe I go maybe a bit slower to not get that. But at the end, that's what I did, and I have to stand by it. I can't just like blame it on.
Absolutely right, bro.
I can't just point fingers at anybody else.
I appreciate it, man. Thank you so
No
much.
problem, bro.
How your family? Like, I know your dad. Like, he's I love him so much. Like, he's like your best friend. You know. So like, not only that, and he was always like with you, which I really appreciate. But how was the reaction of your family, like, or friends? Still today. I mean,
Yeah,
can you explain me a little bit about that?
yeah. So you know, like first month, my my dad was here, and then he left. Then my mom came in. Remember?
Yeah, I know.
My mom came in. So like a year before that, I was always talking to them. I said, okay, that's the only thing I'm 100% wanting from you guys. I never like wanted anything like specifically from you, and it's everything that you did for me was just a favor. I would not count it as a thing. That's just a blessing for me. But this time, I really want this from you guys. I just need your support, not just being there, but like for me, even like mentally. So they knew a bit, like they knew a bit about that. Like, you know, they knew like I'm gonna go through a hard process and everything. It was hard for them to see me like sometimes experiencing hardships and everything, maybe pains that night. I couldn't sleep, you know. These are all the parenthood things. Even if you see your kid right now, like he falls, you know that breaks your heart kind of, right? You want that to happen to you 10 times more, but never to him,
Absolutely.
right? So
Absolutely.
it's a bit harder for them, but like once they know that like okay, that's something that you really wanted, and the more that happens, the more it's easier for them to accept. And you know, and honestly, I said that from the beginning. I said my goal was not just to get the lengthening done and go back and say pretend nothing has happened. You know, I respect that. Some people want to stay private, totally acceptable. My goal was not that. I wanted to see that like okay, there is a rise to that for the right people, for the people like especially like the guys who are suffering that mentally. Because you know, I lived it 100%. I know how tough it could be. So I was talking even like to my close families. I was, you know, my circle is not really big. My circle, like in terms of family and friends, but it's really circle. You know, like similar to you. Like you have close people to you. Maybe it's not 100 people. Maybe it's 5. Maybe it's 10. But they're like your people. So I'm always in contact with them. Whatever thing, like in terms of their opinion. So they knew that's gonna happen. But when they saw me, they were like, wow, that's a nice change. You look now more like, you know, look now more of you. You know, like, you know, it looks better on you. Like now I can see you can be yourself more. You don't have to hide under like, you know, because when I was like that, you always have to carry some misery. Like you always like, you feel miserable a lot of time. You always think about that. Half of your mental, like half of your mind is always like thinking about that. You maybe try to avoid going to the places, going to the crown, going to the like ceremonies, everything, going to even the family events, because you're always thinking about that. So like yeah, when they saw me, they saw like how you're not like shy anymore. You know, I was never shy, but I can say I felt miserable. You know, that's different. I was never shy. You know, I had to be shy. I had to act like, because I was not feeling right. You know, in my head I was not feeling right. And a lot of people who contacted me, they said we're experiencing the same things. And what would you advise? I always said them, okay, first know your priorities, know exactly what you want. If you can take it, go for it. If you can't take it, yeah, I mean, like
Yes,
if you can't
absolutely.
take it, first go see, like, even if you want to do like, for example, I want to do this many steps. Go. I said, don't focus on just a number. Go step by step. If you want to see how does it feel on your body, I
Absolutely,
would
bro.
say go maybe for one, opt
Absolutely.
in for one, then see like how does it feel. Maybe go for the second one after you see like how is it. But you know, that's the thing. But everybody was happy, man, for me, because I was happier. I was a way better person after that. Like in terms of myself, in my skin, I was way happier in every aspect of my life. Maybe I was not like the better athlete just after that, because but my life path has changed so much after like after that. My life path has changed so much, and I think there's always something happen. I always say that everything happens for a reason. Like if I was able to like help a couple people get out of that, I'm way more grateful for that, other than just my personal goal. I was like way more grateful for that.
Daniel, a lot of people asking like about your situation. What about the tibia? I mean, you think about the tibia, or would you say you're happy?
That's the biggest question that everyone asks me. You know, at the beginning, uh, even when I came, my goal was just to do tibia at the beginning. Uh, then we came in to see like let's check the X-rays and everything. Then then we decided to all go with the femur. I said okay, I have to reach this number for me to be happy. To not think about it, you know. Right now I can say like 80% of that is gone. 80% of that is gone. 80% of that was those feelings that I was thinking like okay, yeah, there's all. I'm not gonna lie. At my level right now, I'm pretty average. Maybe a bit. Maybe I look a bit bigger, but in terms of just measurements, I'm pretty average in in Canada. Maybe a bit in the Iran when I go, like I feel a bit taller. Maybe compared to younger generations, you know, like they kind of are like. You see a lot of kids who are around 185 to 195. You know, even my best friends. Even to this day, I did the femurs. I went back to Iran, and they're still a lot taller than me. Two of them. One is 199.
Wow. Okay.
One
But
is
bro,
one.
this is
Yeah,
this
yeah,
is tall, man.
yeah. One is
This is
195.
not a normal height, you know.
The shortest one is 183.
Oh my god.
And these are like the three
Almost like
closest.
you, bro.
Yeah, yeah. He's the closest one to me, and
Okay.
I'm not gonna lie. There's always that small urge in me,
Okay.
but I always want to keep that as a mystery. I want to, not a mystery, but I want to say, if that's gonna happen, it will happen. I have a feeling that it might happen in the future, but right now, you know, as I said, my priority is something else right now. I can't sacrifice that for just a personal goal, which at this point is not 100% for my mental health. It's more of a maybe something that I really loved in my life to achieve. You know, it's like a championship. Once you're a champion, you're like going for another championship, something like this. You know, it's not something like you want to do it just for yourself. You know, just this time is just for your wish. It's not really affecting your mental health.
Exactly.
It's just like maybe I want to be a bit
Yeah. It's
better.
not because of you need it. It's like
yeah,
just
yeah. I don't need it. Maybe like
this is luxury then. You know?
yeah, exactly. It's just like a luxury car.
Yes,
You may not
exactly.
need the Lamborghini to come here.
Exactly.
Maybe you
Exactly,
can
bro.
do with another car.
Yeah.
But you know, that's something that you desire.
Yeah.
Like if I'm gonna do it, it's only for that reason. But if it happens, it happens.
Well, bro, you know everything. Like you know the process. You know everything.
Yeah.
That's the reason, of course. It's for now like different for you. You know, like also to
Yeah.
decide it such a decision. But I mean, bro, as I said, I told you also before. Normally, you came really for the tibia. Remember?
Yeah.
Was 2 years ago.
Yeah.
So
2 years ago.
and yeah, I told him, bro.
You and Dr. Halil both
Yeah.
said the same thing. You said like you're good. Maybe
Yeah.
don't take unnecessary
Yeah.
risk. You know.
Yeah.
That's
Exactly.
that's what I'm saying. Like I came for tibia. Yeah.
Okay.
I came 100% for tibia.
Yeah, I know. I know.
I was trying to quit halfway my position, which I worked really hard for it. But then I was like, okay, there is a no coming up. The doctor himself is saying, okay, maybe if you want to do it, I will help you do it, but be a bit mindful right now. Like you're at this stage, you said that you're good. Like, do you really want to do it? You might end up, you know, with my nerve pain. Maybe it's too early for you. You know, something. Let's do the checkups first. Let's wait.
Bro, to be honest, really, you want to hear your height is really good. Your height and also your femur tibia proportion is good. I mean,
60,
for the cosmetics
184.
reason, you don't need it. As a friend, as a brother, in my opinion, you don't need it.
You don't need it, of course.
You don't need it. To be honest.
The tall and huge guy.
Yeah, exactly. So, I mean, if you want, no problem. Just against surgery stress.
Yes, we
Again,
have benefit by the way after
Yeah.
that, but
Yeah.
you look good.
If I was doing that and I was ending up with like maybe a foot drop, something like
Yeah,
that,
yeah,
and then
exactly.
I'm
Which
gonna
can
say,
happen
oh,
in
that's
this.
your fault. That's on me. I can't really say that. I can't say, okay, that's on you because you advised me not to do it and I still did it and I did something like that and I blame it on you. That's
Well, bro, you know, like I had to choose also to push you to do the tibia. I mean, at the end, it's good for marketing reasons, to be honest,
Of course, yeah,
right?
yeah,
But you know, I always like also before, you know, like to how can I say? I mean, to think as a human. That's the most important thing, the humanity, bro. And that was the reason also I never push anyone, by the way, because I did it 3 times. I'm happy. Well, the question, can you recommend? I mean, yeah, I will recommend to myself, but the question is, can I recommend to you? I don't know. Like, I don't know your condition. I don't know how the process will be. You know what I mean? So because you know, complication is always something which can happen, unfortunately.
Yeah.
But that was the reason also we told you. You know, like, hey, your height is also good, bro. I mean. But of course, now if you say I'm 100% sure I want to do the tibia,
yeah.
we are here, bro. But
Thank
as
you,
I
man.
said again,
Thank you.
your height is really good. You look really amazing,
Appreciate it.
handsome,
Thank you, bro.
great upper body, great body. I mean, great genetics. So I don't think so that you need tibia. But again, that's your life, that's your decision. By the way, guys, 2025 is Daniel's year, right?
Thank you, brother.
If you want,
Yeah, yeah,
you
yeah.
can. If not, it's okay.
Yeah, yeah, no, it's I was
Okay.
open about that. Like I always said that like the same girlfriend that I had, she was supporting me back even because the original plan for me was doing 2020. I talked about it. I said first I went to my home country to
Yes.
do that, and I'm still in contact with a lot of them who did the man. They're doing. Some of them are doing really bad. I'm so what can I say? Like you can't do anything for them at the same time. You kind of feel bad for them. At the same time, I saw myself, my condition. I was like, it's really sad because I know their point of view. They want to do something to make their lives better, but unfortunately, because of the lack of care and just lack of having those essential things to take care of everything. There is a guy. He has done the surgery 2 years ago. He's still with fixators. He did first with the internal method, which is unique for them. But the infection and everything happened. They had to remove, nail broke. A lot of
Which country, bro?
Iran. At the first I wanted to go and do there. Man, these are the moments when you say like you find God in your life. Something stopped me. I was pumped 100%. I even had the money, everything. I said, I'm coming there at the peak of COVID. I'm coming there to do it. And I only had 3 months because of the army situation. I only had 3 months to be able to stay there. 3 months and one day, I had to go to the army, That's it. So it happened, and I said, no, I'm not gonna do it there. And then I came here the day after. So long story short is I've been with my current girlfriend, soon to be my wife. It's kind of, I don't know, it's kind of made me emotional to say that. 5 years we've been together, and yeah, we're getting married this year.
Bro, I wish you the best.
Thank you, brother.
I mean, by the way, this is a real love because
Yeah.
before
yeah.
your surgery, right? I mean, relationship is
Yeah.
was also before the surgery.
It
Before
was also before the surgery.
she accept you like that, and now also with your new height.
Yeah.
I mean, this is a real life.
Yeah.
Like a real love.
Yeah.
Sorry. I mean,
the real
it's like-
thing was I couldn't accept myself. It wasn't nobody accepted. She didn't accept me. I couldn't really accept myself.
she loves you really, bro.
And yeah, these are the things. I don't know if you saw, but a lot of times she was supporting me even from there. She had their own stuff. She was sending me flowers from here.
Wow.
She was sending
I saw, bro. I saw.
Even today,
Yeah.
a couple of days ago, she
Respect, man.
sent me from there. So these are the valuable things, the second time she was really against it, for me to do it, and I said, okay, let me go see what's gonna happen. And yeah, she was also one of the reasons that said, okay, if I want to do it, I want to do it in a time that we're both in a good state of mind. Maybe I want her to be my side on the second time. I don't know. You need to have your priorities. If your love life is your priority, especially if you have your work is your priority, everything is your priority. So you need to know that first.
Also, one topic which I really love and want to talk to you. I saw a lot of videos and also comments of the patients who did it with other clinics, and the doctor saying hey, if you have a complication, you have to pay for it. You know what I mean? So I mean, because we talk about the surgery, but not about the complication. And complication is something can happen. I don't know. So it can happen because of your lifestyle. It can happen because of you have a great genetic. For example, in your case, you had an early union. You know what I mean? Or because of your smoking and like don't pay attention about your nutrition or something like that, diet. You know, I mean everything can happen. You can fall down. It could be your mistake. But the most important thing is, as a doctor, as a team, to stay behind of the job. So um, well, what is your opinion for all those things, bro? Like
For
the
sure,
negative comments, negative.
it has the pros and cons. The pros is going to be like, yeah, there is like a great, community that can support each other, but sometimes they can be bad too because like different cultures, different people are coming. Maybe, and I give them like also the thing that I understand, they are worried at that time. Like they're experiencing too much maybe anxiety of the process that they're wishing like they want everything to go smooth and something happens. Maybe they can delay that or we can like make them make their journey a bit longer, such as similar to me. But at the end, exactly, I need to see like, okay, if I did I do my part right? Did I, like, for example, if I'm going and taking shower with my fixators on, for example, and I'm developing like maybe infection, is it my fault or it's just blaming on you? If uh, like if I'm just going with like walking without like an aid, or like if I can't really like walk with an aid and I don't walk for like a long time, if I'm having like maybe delayed union or I have muscle tightness because I was not being able to be mobile, is it my fault or do I just have to blame it on you? These are the things I'm saying. Like, if you have, and first, during everything, you need to know like what are you putting yourself into. you know there's info all around all over around the internet. You can see pros and cons to it, but at the end you need to decide with respect to your priorities in life, with respect to, like, you can't just jump into the deep water and say I don't know how to swim. you know First you got to learn from the beginning, step by step, and then you learn how to go deep water. So complications is like a unavoidable part of this process. It's not 100% and it's not 0%. As you said, like in the medicine, there's no 100, there's no 0.
Exactly.
So if that happens to you, if you need to accept it as a part of the thing because you opted for it. Especially like, if I'm going for LON, I knew even if the infection goes really really deep, I can lose my limb. There is a chance, but like that's how, like, with everything. If I wake up today, I want to like drive my car, there's a chance somebody hit me, right? Am I choosing not to drive a car forever? No. There's always these things. You need to see, like, first, how can you minimize that risk for your case. For example, I had my father with me in the first month. I said I could never have done it without him in the first month. Because why? Because when I wanted to go to toilet or when I wanted to stand up, I needed somebody to be there, right? To help me with that. And if I was coming and I said, "Oh, you didn't tell me," no, I did my research. I knew I needed that support, and I needed that thing, and so I knew what to do exactly. So I can't really say like I can't really speak for anybody, but I always see like this negativity coming on, and I see a lot of I'm trying to be like not judgmental, but like sometimes I saw a lot of misbehaving on their side, and it's so easy after everything is done. After everything is on the other side, you just blame it on the other ones, and like you try to like say this, everything is crap, everything is crap. It's unacceptable, man. It's really unacceptable because I got my dream. I reached my dream here with your help.
Appreciate it.
Thousand other people reached their dream over here. Maybe I didn't have the easiest journey. A lot of people didn't have the easiest journey. A lot of people have really smooth journeys, and like I can't say what. Oh, so why I didn't have the smoothest journey? You promised me I would have like a smooth journey. Did you say that? No. It can go wrong. It went wrong. It took me longer. It took me longer for me to get back on my feet, to go and, like, especially in my field of work. It took me a lot longer for me to go and be where am I right now. But these are all the decisions that I made. I can't if I was doing femurs and right away tibia, maybe I was developing more complications, and that was being more double time, and maybe I was not even able to be where am I right now. Is it fair for me to say that this all on you? No. These are the things that you first need to know. Like, you know, that's what I'm saying. Your priorities matter so much, man. It matters so much. You can't just jump in and they say I can't. So all these negativities at the end, like, you need to decide by yourself. Is this something that you want? If that mental thing is bothering you so much that you're willing to undergo this,
Absolutely.
this is all depending on you. Here is like a vehicle. I always say here, or like any other clinic. Sometimes I get pissed because, you know, I have, you know, that was the thing. I earned my dream. My dream became true here with your help and everything.
Appreciate it.
And I really like. Sometimes I felt like it's an insult to hear. You know, sometimes like the negativity when it's fair, when they say, okay, for example, if Sedat, you didn't answer me like in this thing, maybe you have hundreds of other things. Is maybe sometimes it's a fair judgment like to them, but they don't know the condition behind. But sometimes it's like really not fair. You know, sometimes it's really not fair. Like the comments and everything is not really fair. And yeah.
Well, bro, we as Livelifetaller, we always being transparent is the most important thing. I mean, I'm checking like the internet, bro. We are the only place who's talking about complication. We are the only place who's sharing really X-rays of patients, different, for example, YouTube channels to explain about different patient experiences. You know, Instagram is for marketing reasons for sure, because people should know what we are doing. You know. But I mean, there's no other really place, bro, who really share any patient information, stories. You cannot know if like they are doing surgeries done or not. So as you said, there's a lot of hardcore complication cases. I mean, of course we have also complications because we are doing surgeries, but thanks God, bro, none of our complication was really such a worse complication as the pictures, bro. I mean, I was shocked once you sent me the pictures, and that was a lengthening patient, right?
Yeah.
And imagine, bro, like
Yeah. Just dealing with that, not knowing what to do after dealing with infection. I've seen it all, you know. I've seen it all because I was one of the first ones who were like, as a patient, I was transparent with it. A lot of people were trusting me, like even like inviting me to different
Yeah.
groups, like asking me
Oh
a
my
lot of
God.
questions
Oh
and
my
like showing like just giving me their experiences. They were explaining their experiences. So I've seen it all, and I'm not just saying that because I was a patient here. I'm saying that because like I lived the past life and I'm living now, and I went through the process. I know exactly every single step, and I was not an easy candidate. I was always say like I was a hard candidate.
But you're a fighter, bro.
That's you have to be. That's what you have to be. Otherwise, man, like otherwise you can't do it. I always have that. Like you have to have that fighter mentality to go through anything, any of the life challenges. And if that thing is bothering you mentally, that's a challenge for you. So if there is a way for it, go for it. Otherwise, you have to. By the way, for example, I know a person close to me. I'm not gonna say who, but like he's close to me. Yeah, he was experiencing exactly what I was experiencing now. He's like in his 40s, but like he's still experiencing that. But he never dared to do anything for it. He's still suffering, you know. That's the thing. And I always was thinking like, if I'm projecting, I don't want to be like that. It's funny because he kind of gave me the idea 20 years ago that such a thing exists. So and like and I'm always grateful for them, grateful for him. He's one of my closest relatives, and we're having so much fun together. But he kind of planted the idea of limb lengthening in my head 20 years ago, and he was always like measuring me when I was a kid to see like how much you grow from this. For example, one day I remember like he was measuring us maybe 5 times a day, early in the morning, midnight, and like that kind of made me like, you know, self-conscious about my height.
And what stopped him to do the surgery, bro?
Fear.
Okay.
Fear. It's really
Fear is your enemy, bro.
Exactly.
You know,
Exactly.
fear is your enemy. Unfortunately, because of fear, you cannot get success. Because of fear, you cannot reach your dreams. Unfortunately, bro, fear is always the biggest enemy.
Even though I love him, but this fear thing, like I mean, his mind was really against him. He didn't do anything to kind of fight that back.
But bro, fear can never protect you from the reality. You know what I mean? That's the point.
Yeah, yeah.
But unfortunately,
Sometimes it's good to have, you know, like how can I say, like
I mean, sometimes
logical fears,
exactly.
you know.
This is something different.
Yeah,
But you know what I'm talking
yeah,
about, like
yeah,
which fear.
yeah, exactly.
Thank you, my brother. I really appreciate it for the great video. Always nice to talk to you, bro.
Good to see you.
And
it
good to
was-
see you also. I mean, we
So-
have right now almost 4 years relationship,
Yeah,
and you are
more
really
because I was in contact with you
exactly,
before. Yeah?
exactly. You and your dad, your family is really a good close friend and
Thank you,
family for me, which is which I love this job because I met a lot of people's. Yeah, sometimes people's, but sometimes also really good people's.
Yeah.
Can I say, like, it's a part of my family. You guys are definitely a part of my family.
Thank you, brother. I
Thank you
felt the
again for
same.
your trust, bro. Thank you for your time, and I really appreciate it, my brother.
Thank you, brother.
By the way, guys, you can follow him on his Instagram channel. So, and Daniel's always ready to answer your questions also as a patient because he knew all the problems, also the mental problems.
Yeah,
His
yeah,
story
yeah.
is similar to us, so
Yeah,
they can contact you, right, bro?
for sure. Some, like earlier, like I was getting a lot of requests when I was recovering. I was spending a lot of time talking. But once you get kind of go through your own life and life challenges, it's kind of become harder. Some people, like, how can I say, like, it's like they don't know zero about it, and they expect you to like answer all these questions. Like, it's kind of not really possible, That's why, like I said, always said, like, usually some people who are really serious, they'll contact me. They always like, I always put my weekends mostly like talking to them, to be honest. Like, I'm booking them like to talk to them like one by one, and they get their answers. But at the end, like, I would always give them the right insight. A lot of people did it, especially like 2022. I knew a lot of people were always like came here, say, yeah, they were sending me pictures. I'm here because of you. I'm here because of you. And then something was happening to them. They were in contact with me. But unfortunately, bro, sometimes there were also some people who were coming like on my side, but like it was they were like, their expectations were not like, they felt like they came here for a ride, and sometimes they were like, giving me bad negative comment, they were giving me bad. So
But
I
bro, you
kinda,
can never stop such
yeah,
and such a people,
yeah.
like,
They were like saying,
no hobbies, nothing, and
and at the end, I never advise or not advise
Of
anyone.
course,
I
you are
just
not
give
this
you
type
the
of guy,
yeah,
absolutely.
exactly. I give you like an insight.
Okay.
I give you my personal experience.
Okay.
I give you like all the detail.
Okay.
And also there are cases where like I give them like especially
Some
like
tips
yeah,
or-
there are people who are in contact with me that I don't like, it's as a friend I just do it. But most people like who I don't know really personally and just want to like, the real ones really like they book with me, we talk, and they decide. And yeah, but if anyone is serious, they will contact me.
All right, we will put your Instagram
For sure,
here,
for
bro,
sure.
and
I'm always
thank you so much for your time. I
you're
really
welcome,
appreciate it,
brother.
my bro.
Appreciate it. Thank you.
Much love, and
Thank you.
see you in the next video, guys.
Take care.
Greetings from Istanbul. Bye bye. Thank you, bro. Boy, it's cold, right?